well-being, stay healthy. Health and well-being are tonics for a happy and stable life. Well-being on AD4 TV Radio brings you lucid insights and hands-on engagement of issues towards your positive well-being. Watch Well-being on AD4 TV Radio. Well-being, stay healthy.
Hi there, this is Well-being on AD4 TV Radio. I am Eugenia Yoheme. Thanks for joining us. Cholera at the moment is a huge issue within public health circle. Several persons across some states of the Federation have come down with even leading death. The cholera strain is really severe. But not to worry, as I'm joined by Dr. Obinna Ibirim. He is a public health practitioner and health promotion specialist. He will be giving us more insights on the topic. You're welcome to the studio, sir.
Thank you. I'm glad to have me here.
Yeah. Okay. So now, what is cholera?
Cholera is an acute diarrhea disease caused by a bacteria known as Vibrio cholera. Usually, people contact it by either eating an infected food or drinking an infected water. That means a food or water infected by the bacteria that causes cholera.
Okay, so what are the possible symptoms of cholera and what are the causes?
Okay, so as I said, it's caused by a bacteria, and then that bacteria usually it passes through when someone who is infected defecates, and then that feces infects either food or water, and then a healthy person injects it, and then the person gets infected with cholera. Some of the symptoms, as I mentioned, it's an acute secretory diarrhea infection. Diarrhea meaning that people come down with diarrhea and vomiting. Diarrhea means frequent stooling. Yeah. But unlike other diarrhea diseases, the cholera diarrhea has a characteristic type of diarrhea called the rice water stool. So you see flecks of mucoid on a watery stool. So it comes as if it's this water you get when you boil a parboiled rice.
Okay,
yeah, so those things are just mucoid flakes on a very watery stool. So people then stool so many times, and in the process they lose fluid, that's body water in your body. Okay. They also lose electrolytes in your body, and then over time the person becomes dehydrated, go into shock. And then most patients who die of the cholera actually die because of the hypovolemic shock. That is shock due to a reduced amount of fluid in your body.
Okay. So on the causes now, initially I usually hear fruits. A lot of emphasis was laid on fruits. So apart from water, fruits too, I don't know.
So fruits fall into the category of food. The most important thing is the fact that it's more like a disease of poor hygiene. Okay. So, and then it's passed through the bacteria is shedded in the feces. Okay. So what usually happens is in areas of poor sanitation, people either defecate on open surface or a body of water.
Yes.
Then people then go to drink that water because there is no adequate clean water for people to drink. And in the process, they get infected. That's on one side. The other part is if people defecate and then probably in an open space, it then probably either birds or flies pick it and then drop it on vegetables or on fruits, or people who do not wash their hand properly, who are infected, would now rub the surface of food or fruits, and people then inject this when it's not properly cooked, or the fruit is not, the surface is not peeled, right? Mm-hmm. People then get infected. So it's important that it's something that is fecal oral, so it goes from the feces out and then it gets into the mouth. So whatever it comes in, whether it's through someone eating a food that is contaminated, drinking water, or maybe a hand that is infected, getting into the mouth. Yeah. What's important is that it will go through the feces and it will get into through the mouth. So whatever you do to prevent whatever that gets into your mouth from being infected, or if it's infected, you are ensure you're killing the bacteria either by cooking the food well, or avoiding a food or drink that is contaminated, then you'll be preventing cholera.
Okay, so who is most susceptible?
Okay, so people who are in area with ongoing infection are susceptible. People who are in areas with poor hygiene are susceptible. With poor sanitation are susceptible. People who would not wash their hands while eating, people who do not practice any of the hygienic practices like washing your hand, or eat raw food, raw vegetable without cooking that vegetable, they are more susceptible. So basically, it's, as I said, it's a disease associated with poor sanitation and hygiene. So people who live in areas with poor sanitation, and then also it's also a disease of poor social amenity development. So if people do not have the common amenities like access to clean water, access to good toilets, either the deep pit latrine or the water flush system, people who do not have access to these social amenities, or with those with poor sanitation, are more susceptible than other members of the population.
Okay, so unlike other diseases like HIV, it has its own ways of transmission. So how is it like with cholera?
Okay, so the difference basically, as I said, it's more like fecal oral. So with cholera, someone that is infected must have to shed it through their feces, and then someone will have to get it. The healthy person will get infected when they eat something that is infected or drink water that is infected. But unlike some other diseases that are, for example, you talk about COVID. COVID is more of respiratory. So someone has to now sneeze out or cough out and all that, and then someone picks the droplet. Or when you talk about HIV, AIDS, and some of those that you have to then get infected through exchange of either a bodily fluid or blood, right? So those are the various types of transmission. But for cholera, it's fecal oral. So it must go through, someone must shed the feces with the bacteria through their feces, and another person have to then pick it up through what they eat or drink.
Okay, so are there mild cases or severe cases, or it's just basically intense?
So I would say on a general note, cholera is a severe acute illness. Severe in the sense that in most cases lead to death if something is not done to stop the progression. And then it is also acute, unlike other diseases that take a long stretch course of disease. Someone that is infected with cholera can begin to show symptoms between 12 to 4 days, and then within 48 to 72 hours, the person can die if the disease progression is not stopped. So in most cases it's severe, and why it's severe is because it causes a very severe kind of diarrhea in which the person stools frequently, and that stooling is very watery and copious, such that people are almost like shedding off all the fluid in their body, and fluids play a very important role in the human body, right? And not just fluid, this is also fluid electrolyte. So you're losing your sodium, your potassium, and then the person will then get into shock. Apparently when you get to that point, the person will die most times, unless we then are able to, as doctors, able to replace the fluid. So that's why when people who are infected with cholera, they have to then quickly replace fluid. Either if it's the home therapy, you can begin to give the person ORS, but then once the person gets to the hospital, they have to then set up an infusion line and begin and try to ensure that you are replacing the fluid the person is losing, while you try to control the diarrhea.
Okay, so what methods are readily available for diagnosing cholera?
So it's not something that is difficult to diagnose, because we have very good laboratories in Nigeria that can pick up bacteria in stool. So and then also the symptoms are not like any other symptoms. Like with COVID, you can say, okay, there are a lot of respiratory illnesses that have similar symptoms with COVID, so it's difficult. But with diarrhea, with cholera, the diarrhea pattern is a bit different. The stool type, once you see that rice water stool, you know it's cholera, and it's frequent stooling. So it's not difficult, but however, if you go to a laboratory and you now culture this stool, you look at this stool, you're able to pick out the bacteria which causes cholera, which is the Vibrio cholerae, and then you're able to make that diagnosis. But then, as I said, since the symptoms are quite are known and they are not, it's not something it's difficult to pick. It's always important to begin to treat the person, because then if the person is losing fluid, that patient is losing fluid, and you don't do something about it, if the person gets into shock, then the condition will worsen. So yeah, so it's not something that is very difficult to diagnose.
Okay. So how many days does it take for you to know that this person is suffering from cholera? Because some people might be stooling actually, but it might not be it.
Yeah, so usually, as I say, the incubation period is between 12 hours to 5 days. So some people can get infected, and within 12 hours they begin to show symptoms. Some it will take them 2 days, 3 days, and up to 4 to 5 days. Some people might be asymptomatic. There are some people who are get infected, they don't show any symptoms, but then they still shed the bacteria in their stool. And then if they are not practicing good habits, like if they are stooling into an open water body, then people who drink that water will get infected. Okay. And then someone might not show symptoms, but someone will drink a water infected by that person's stool and begin to show symptoms. Okay. So it's about, the incubation period is about 12 hours to 5 days. Some people can be asymptomatic, no symptoms, but then they are able to transmit the infection, while others would come down with symptoms, mild symptoms, and some very severe symptoms, so many frequent stooling, and then going into shock.
Okay, I've been talking to Dr. Obinna Ebirim, but I'd like us to go on a short break, and don't go away.
This is Impact 360 on AD4 TV Radio. This is a no-hold-barred program that x-rays and dissects, engages and interrogates, brings perspectives and understanding to anything and everything that impacts our lives, the choices we make as individuals, businesses, and state actors. Impact 360 leaves nothing out, from policy to people, lifestyle to culture, business models to innovation, and from known to the uncharted frontiers. Nothing is out of the radar. Everything in the circle.
You're welcome back. Okay, so now, initially, I don't know, I've heard, but I'm not very sure, but since you're here, maybe we can get direct answers about, is there a vaccine for cholera?
Yes, I think that there is a vaccine against cholera that's being approved for use in the US that has a 90% efficacy, but I'm not sure that that vaccine is being used in Nigeria. I think at least I'm very sure among the routine administered vaccine, what we call the routine vaccine that is given during the routine immunization, there is no vaccine given against cholera. However, there is a vaccine that was recently introduced against diarrhea diseases caused by rotavirus, not Vibrio cholerae bacteria. So in Nigeria, there is no vaccine being administered against cholera, but globally there is a vaccine that has been approved against cholera.
Okay, so how is it treated? Okay,
so basically the primary treatment is rehydration to restore fluid. But as a bacteria, there is known antibiotics that are used to kill the bacteria. Okay. But this is not something that should be said for people to then begin to abuse it. So what's important is people can ensure that at least for home treatment, make sure that if they suspect, they are quickly getting a lot of fluid while they go to the hospital. It's not something you manage at home, because then the loss is so much that you have to now give IV fluid, not just oral fluids. So, and then when you get to the hospital, as quickly as the patient can begin to tolerate oral medication, yes, then the antibiotics can be administered to kill the bacteria and stop the cause of the disease. But the primary management is replace the fluid that is being lost.
Okay. So when we were growing up, there was cholera, but now the digits are actually rising every day of death cases, and people that are suffering from it. So what is different? Has anything added to the reasons why people get cholera, or is it the same thing?
The thing is, now there is more, I would say, disease surveillance, and then people are more like, you have the agency of government that controls disease outbreak and the epidemics and pandemic. They are now on a more watch out for such diseases, so you can really know the real number of people, or something close to the real number of people who are now infected by cholera. I don't think that the numbers has now increased, unless there are communities that their sanitary condition has worsened.
Okay.
Right, and then you then see an increase, or communities where the social amenities has broken down, then you would now see an increase. If you look at it from that lens, yes, there might have been increase, because then before now, you in rural communities, you would see public water, well maintained public water supply, but some of those public water systems have broken down.
Exactly.
Right? And then in the past, there was discipline around sanitation, so you have days that had sanitation days,
General
right?
cleanups.
Yeah. And then you see communities coming together to clean their environment. Some of those
True.
practices have stopped,
Yes.
and sanitation in some of these local communities have worsened. So those are the reasons that you would say that there is now an increase cases of cholera. But more important is that now there is more there is more surveillance. People are now being proper, and also proper diagnosis. So in the past, a lot of people died from cholera without knowing.
Yes.
But now people are able to know, okay, that this death is due to cholera, and there is good. People are taking data and counting, and so you can say, okay, this is also number. So those are the reasons that one can give for an increased number of morbidity or deaths due to cholera.
Okay, so maybe for adults, somebody might be able to, you're able to explain exactly what the problem is. But for infants, very little children, I say a lot of children die because it's so much for them. They cannot handle it. So what is it in children? How is it like?
So in children, the thing is with cholera, the most common symptom, or a symptom that distinguishes it from other types of diarrhea, is the nature of this stool, right? So once a child is stooling frequently, you need to take that child to the hospital, because an adult can afford to lose more fluid than a baby.
Yes.
Right? So I think what's important for the general public to know is that once a child is having frequent stooling, you can start with some home medication like the ORS, the oral rehydration solution, to try and make sure that you're rehydrating that child. But as soon as possible, you need to take that child to the hospital, because you don't want the child to get into severe dehydration with sunken eye, and it's not even able to cry or even tears. So it's important that once a child is passing frequent stool, you take that child to the hospital. For those who know about the nature of the cholera stool, once you see this stool, you will know with that characteristic rice water stool.
Yes. Okay, so why do they call cholera blue death?
It's not really a term I'm familiar with, but what I know about cholera is that the person would get dehydrated, right? Most times when people are getting dehydrated to that extent, you can still get the person is maybe going blue or turning blue, right? So that could be the reason, but it's not a term I'm so familiar with. But what I know is that cholera, the key thing is dehydration. The person is losing fluid. As he's stooling frequently, is losing fluid, and then obviously the person will get dehydrated, and then so pale, it's about blood. When the person is losing blood, right? When someone is dehydrated, you see that the eyes are sunken, right? And then when the skin, it loses it. So when you pinch on it, it takes a longer time for it to return back. Then the person does not tear easily because the person is losing fluid, and then obviously over time, if that's not controlled and the person begins to lose fluid, the person will then go into shock because of the electrolyte. It's also similar to what you see in people who lose a lot of blood, right? The person is also losing fluid, and then the person will go into shock also due to that, because the person has lost a lot of blood.
Yes.
Yeah. So I think what is important for the general public to know is the fact that someone who has diarrhea will be losing a lot of fluid, and that will be due to the person vomiting a lot, stooling a lot. Yeah. And then what then eventually kills the person is the when person has lost a lot of fluid, which also has electrolytes, and then the person goes into shock. And at that point, it's important that to note that once you see someone who is now stooling and vomiting, this period that you're having a lot of that, the person must then go to see a doctor to make a proper diagnosis and then manage the case. But then I think what is very important at this point is how do we then prevent cholera, right? The key thing is the simplest one is always wash your hand after the toilet, before eating, when you come back from the market or from outside. Always wash your hand. And the good thing is when you wash your hand, it keeps you safe not just from cholera but from other diarrhea diseases and even diseases like COVID,
yes.
Right? Then the other one is do not stool, do not defecate in open body water or defecate in the open surface, because then people can then pick it through other indirect means and then ingest and get infected. The other one is you need to only drink safe, clean water, right? You can boil water at home. You mustn't buy the bottled water or the canned water, but you can boil your water at home and then allow it to cool and then you drink. So drink clean water, then also cook. Especially during this period, make sure you're eating cooked food, right?
Very well.
Cooked food, let it be well cooked, because then when it's cooked, it will kill the bacteria that causes cholera.
Yes.
And then avoid eating raw vegetables and fruits that are not washed or their surface peeled, because then because of areas with poor toilet facility, people still stool in the open, and then things like the housefly can pick it and then drop it on or people who sell these fruits might be infected and not showing symptoms or recently being treated, and if they're not properly washing their hands, they can then infect this fruit and people buy it, and
some people just buy and they
eat immediately. So please, this is not a time to then buy and eat. Ensure you're washing it properly, and if possible, peel out the surface, the outer surface, and you eat. If you have vegetable, you can cook it and steam. Even if you want to eat it near raw, you try and cook it in a way that at least it kills the bacteria, and wash it properly. You can wash it so many times, like the common ugu. You can wash it over and over again. Then you now cook it. At least let the heat kill off any bacteria on the surface before you eat. And then on a general note, it's also that government should also try to improve the social amenities, ensure that people have access to public clean water, right? Because some people might not be able to afford the clean source of water, but if there is public water supply, then at least the general public, especially the poor people, can access it. And then make sure that there is also public toilets. People in mass housing have access to good toilet facilities. So those are kind of on the general things government can help to do. And then on the general public should ensure that they keep their environment clean, right? In communities, people should discourage people open defecation into a body of water. So by so doing, we can all keep ourselves safe from cholera and prevent its spread.
So does that mean that the government, there's no campaign, like there's nothing in place put for people to know more about cholera, because it's no longer a child's play anymore?
No, I think there is, but then obviously there is room to do more. I know that the NCDC is leading the campaign is leading the public health response with the increasing number of disease cases we are seeing, especially in some areas in northern Nigeria. The NCDC is leading the response. And in like every other public health response, there is a component of health promotion where you try to sensitize the public about the prevention and how to control the disease spread. But what I usually say, it's we need to ensure that that messaging is done in a manner that resonates with the poor people, with the rural people.
Exactly.
Right. So it should be in a language they understand. Sometimes we ignore that there is over 100 or thereabout languages in Nigeria, and we focus on the major languages, thereby leaving a greater population who do not hear this language.
True.
Yeah. Then also we also should know that a greater population are in the rural community. They are poor and they do not have access to some of the newer media, like the social media, and then we then have to communicate in a language and in the manner that resonates with them. So do we have to use town criers? Do we have to use local radio stations, right? And then do we have to write it in pamphlets and leaflets and translate it in their languages, right? Do we have to use their traditional religious leaders that influences them more to pass this message?
Since they go to churches and mosques.
Exactly, yeah. So it's important that when you're sensitizing the public, you do it in a manner that resonates with them, in a context that applies to them, and in a way that it can get to them.
Exactly. Thank you very much for coming on the show. It has been very insightful. I really appreciate your coming. Thank you very much. Don't forget that you can protect yourself and your family by using only water that has been boiled, water that has been chemically disinfected, or bottled water. It has been Wellbeing on AD4 TV Radio. Until I hit your screens again, it's bye for now.